Hello and welcome to PCR TV. My name is Kornowski from Rabin Medical Center in Israel. And with me here, Dr. Sonia Petronio from Pisa, Italy, and Dr. Darren Mylotte from Galway, Ireland. Hello.
Hello.
The topic is the guidelines and recommendation about TAVI, transcatheter aortic valve implantation. We had a session today, and I would like to start with you, Darren, and ask you, what is the new information about transcatheter aortic valve implantation?
Well, Ran, we've seen some very interesting information emerge in the last number of months. We've seen the publication of the 2-year data from the PARTNER 2 trial demonstrating that TAVI in intermediate risk patients is non-inferior to surgery. And indeed, if you can perform that TAVI via transfemoral route, you may have significantly reduced mortality compared to surgery. We've also seen emerging data from the 3-year high-risk core valve trial in the United States suggesting that TAVI continues to be superior to surgery for an endpoint of mortality and all-cause stroke in that cohort. This information, combined with other randomized trials, is leading to the imminent publication of a meta-analysis demonstrating a 13% relative risk reduction with TAVI for all-cause mortality compared to surgery. And again, if you can perform the TAVI via a transfemoral route, that relative reduction in mortality is up to 20%.
This is very interesting. I would like to ask you, Sonia, about where are we standing on the matter of recommendations and indications. We know the guidelines as of 2016. Where are we heading with this matter?
Well, you know, already 4 years have passed since the last guiding lines, and in this period we have changed the indication of the patients, the cohort of patients that we are enrolling and we are treating with TAVI. It's slowly changing. They are a little bit more younger. They're not, let's say, anymore over 80s. They are a little bit less with risk because we have adapted ourselves to the new information that we have from literature, and that from the results that, as you have heard before, are now common to all interventional cardiologists. So we were slowly moving from high risk or extreme risk to intermediate risk and to patients that, as are a little bit younger, have less comorbidity. So the results are definitely better.
So would you say that it's not just about the extreme risk of very high risk patients? Are we heading towards low risk patients, and you think that the recommendations or potentially the guidelines would be changed in the future?
Well, I think that we should hope in a slow shifting of the risk of the patient and the indication towards the intermediate risk. We'll have to wait longer for the low risk patient and the very young patients, but I think that an intermediate risk would be a good category of patients to consider, and the high risk patient should really have the recommendation for TAVI instead of surgery.
What do you think, Darren, about the emerging or expanded indication of TAVI?
I think we have one trial demonstrating superiority via transfemoral TAVI in intermediate risk patients, and we keenly await the TAVI trial, which is comparing an expandable TAVI device to surgery in intermediate risk patients, and that's due to be published next year. It's also very encouraging to see the major TAVI players committing to and having agreed low-risk TAVI trials with the US FDA. I think that this indicates a very clear shift towards treating lower risk patients, but again, we need to wait until that information is available. But I absolutely agree with Sonia that there can be no doubt for the guidelines next year that high-risk patients should be treated with TAVI, and indeed intermediate risk patients should also be very strongly considered.
Okay, so we need new data in order to design the new indications and the new guidelines, and this is probably going to happen over the next very few years.
Absolutely.
So I would like to thank you very much. It has been a pleasure, and have a nice day.
Thanks,
Thank
Ran.
you.
Thank you.